Good evening and welcome to yet another episode of the Health and Wellness Show. My name is Chabet Birir, na kama kawaida, this is where we inform you, we empower you and inspire you to take control of your health and live your best life. And today we are talking about a very important topic. It's called fetal alcohol spectrum disorders. This is a group of conditions that affect someone who has been exposed to alcohol before birth. Now, on set, I have Dr. Odhiambo Nderitu, who is a reproductive health specialist, and she's also a midwifery expert. So she deals a lot with pregnant women and lactating mothers. So she'll explain to us what happens when you expose your child to alcohol before birth. Karibu sana, Dr. Nderitu.
Thank you.
First of all, tueleze, what are the effects or what are these conditions medically zinaitwa aje when you expose a child to alcohol before birth?
Thank you very much, Birir. I'm glad to be here once again to discuss pertinent issues that touch on us as women and men, couples who are actually getting ready for their reproduction and all that. So today we would like to delve on this topic that is very interesting, and I would like to say that fetal alcohol spectrum disorders are a group of conditions that actually affect, especially when the woman is pregnant. Now, this fetus that is growing is actually affected, is exposed, all right? So at the end of the day, you realize that there are quite a number. It's not only one. Of course, we will try to talk about the most common one, which is fetal alcohol syndrome, because it is actually the most severe form. Okay, it's the most severe form and actually what we have interacted with so much in the field. So there are others. We also have partial fetal alcohol syndrome. We also have another one called alcohol-related neurodevelopmental disorder. So there are quite a number.
There are quite a number.
Yes.
And of course, I tried looking up the figures and I couldn't find any. It's just the general figures. So about 1 in 20 children.
Yes.
And it's mostly in the US that you have 1 in 20 children have this syndrome, fetal alcohol syndrome.
Yes.
And of course, we also have 1 in 7 pregnant people in the US again who report drinking alcohol, and about 1 in 20 actually binge drink. This means they drink often.
Yes.
I would imagine that this also applies in Kenya, considering how we are a drinking nation. If you go to the clubs, you will find pregnant women drinking and partying. Of course, mostly are Gen Zs. Na msiniuliza nilijuaje. Sijasema huwa naenda huko. Niliokoka, niliacha. But yeah, that's what happens.
Yes, sure.
So why does this happen, first of all?
Yes.
And then what are the effects of exposing a child before birth to alcohol?
Thank you very much. Now, let me just make a point to bring us close and on board. Now, I would like to put this very firmly. All those women who are watching me today and listening to me today, and even those who are planning to be pregnant, there is no amount of alcohol that is safe during pregnancy. That is one thing you need to put in.
Wine.
As long as you're planning to be pregnant, there is nothing like alcohol and pregnancy. They don't go together.
Okay.
Because of the adverse effects that the pregnancy will have. Actually, the effects will be more on the fetus compared to the mother. And that is why we say, as long as you're getting ready to be pregnant, you're pregnant, alcohol should be a no-go zone. All right? Because every sip has the power to change and to shape the life of that baby. All right. So there are various effects. When alcohol is taken during pregnancy, there are various effects that touch on different areas and aspects of this woman, and especially the baby. Okay. Now, let's talk about the baby a little bit. Of course, we'll call it fetus, but because we are in a team of people who may not understand so much, we will talk about the fetus. Now, the fetus will have so many effects, including those that touch on the cognitive development and learning abilities. Number 2, it will also affect the behavioral development of this baby, and that goes hand in hand with the social development. And number 3 is it will also touch on the physical aspect. So this baby will have manifestations. We can actually be able to see how this baby looks like. The baby has just been born, and the physical features of this baby will tell you something is off because of how they look. Now, let's just let me describe each one of them very briefly.
Before we go there,
I
want us to talk about now the pregnancy.
Yes.
During the pregnancy. What about, umesema there's no amount of alcohol that is safe?
No.
Na kama sasa nilikuwa nakunywa before I knew I was pregnant, what happens?
Okay, thank you. Now, if you are drinking, taking alcohol before, and we have so many of them who do that, when they come to the clinic and they want to start that journey of being pregnant, what happens is that there's a concept we call preconception care. And there's one thing many people don't know. Preconception care begins anytime between 3 months and 1 year. So you walk into my clinic today and tell me, oh, I think I'm ready to have a pregnancy, which, Birir, none.
I can tell you for free.
None comes.
It never happens because...
No one plans for pregnancy, right? So I'm just saying that for the sake of this, so that we can remind you people, you need to come to our clinics and seek, some advice on how to plan for your pregnancy.
Because personally, for all my 3 children,
for your
daktari, nilipata na butua. Okay, of course, I know what I did, but I didn't expect. So preconception care is... foreign term to many women. Okay. So what would you advise
Yes, so
them?
this is what I wanted to explain. So during preconception care, when you come and tell us, I want to get pregnant, this is a couple that has come. So we will start preparing you and we tell you, we take history. One of the most important histories that we take that touches on now alcohol is what we normally call the lifestyle history. Lifestyle touches on exercise, touches on drugs, smoking, and also alcohol. So once we take that history, we'll be able to ask you questions. Do you drink? Do you take alcohol? Then you tell us, oh, I also do some drugs. And then we'll be able now to tell you, see, you need to start preparing for your pregnancy. So you need to stop. Stopping may be hard. So we try to wean them off slowly. And that is why we are giving you a period of 3 months to 1 year to prepare for your pregnancy. Okay. So all those who don't show up in the clinic, they are at risk because now they will not know what to do. By the time they are realizing the effect and the impact, and you see, once you get pregnant and you set in, we have trimesters of pregnancy. First trimester is very critical. This is the stage where we are talking about embryogenesis. The baby is being formed. So now if you didn't know, automatically this is, your baby will be affected from the word go. So we need to prepare you for the pregnancy. So that we tell you now, alcohol, no, you need to stop.
Easier said than done,
yes.
Daktari, because the 2 most difficult questions to answer when you see a doctor, are you drinking? And are you sexually active? Hiyo hata wewe unaweza jibu kwa urahisi.
No, it depends. It depends, because you see, doctors, midwives, they are trained. Whenever you are with a client, there's that training that helps you to create rapport with your client, and then now you'll be able to get information that you want from them. Other than that, well, I know it's difficult. When you ask me if I'm sexually active, I will tell you, no, just to please your ears and to make you feel good about it. But I would like to say that there's that relationship that we create with our clients, and it comes with a lot of, it's learned. You don't just know how to deal with clients, you must learn it. And what to tell them at a particular time.
And still on that, can you tell if a patient is lying to you that they're sexually active or not taking alcohol, especially a mother? Now, tuache sasa sexually active.
Let's just come back to alcohol. It would be difficult to tell because you are the one giving me the information as the client. So it may be difficult to tell, but you see, again, it's not a one-time thing. I'm not seeing you for the first time and for the last time. I hope to see you often and, regularly. So somehow, actually, you see also the mother, alcohol itself also interferes with, your how do we call it? Your daily concentration, daily activities of living. Even when you talk about things to do with memory, concentration, it affects you somehow.
Bloodshot eyes.
Yeah. Yes, and even you can imagine a woman who walks to your clinic and she's coming and probably she's drunk. I can easily tell that. So it would be hard, but with the continuous interactions, maybe we can reach a point where now this woman will be able to open and maybe say. But at that point in time when you're talking and she tells you no, but also it depends on how you're talking to this woman. For me, they will not. For you, they will rarely. I think experience also really helps us. Now we learn how to deal with the women.
Now we have cases of course of addiction. You have a mother or a now expectant mother who is totally addicted to alcohol, and research actually shows that more than 90%, or is it 80%, of expectant mothers who are abusing alcohol are also abusing other drugs,
Yes.
cocaine, bang, and other hard substances.
Yes.
So how do you help this expectant mother overcome those addictions so that they can be able to, keep the pregnancy healthy?
As a medical professional, as a healthcare provider, I have the leeway, I have the authority, I am in charge at that point when I tell you, you don't have the clean bill to become pregnant. Wait, we treat you first.
But what if they are already pregnant?
Or if they are already pregnant.
Yes.
Okay, now if they're already pregnant, now you see, this is a woman who I would want to see very often in those clinic visits. But it will be difficult. You see, addiction is another level of, we are dealing with a very serious level of, alcohol intake and drugs and all that.
Yes.
And it may be very hard to reverse. Now, if she's pregnant, truth be said, the prognosis, this pregnancy may not. Addiction is very serious. And you see, taking you back from that addiction will also take me a long time to walk you through from it. So, of course, we will say you're pregnant, yes, but now we have to agree. We have to agree. You have to take care of yourself first so that you can take care of that pregnancy. So we'll put, even if we have to put you through therapy, if we have to put you through, some kind of a plan, a diet, so that at least you can, your immune system becomes compromised, very vulnerable when you're taking alcohol. So we need to really do a lot to boost your immune system as well, so that at least we can reach a level whereby you can sustain yourself and sustain that pregnancy you're carrying.
Absolutely.
Yeah, so it requires a lot of effort and a lot of positivity thinking from this woman, so that we can be able to work together.
I'd call that now the One Health approach. Like you as Daktari, you're not a therapist. So once you identify that this expectant mother is addicted to alcohol, do you engage now other partners or medics, that is psychiatrists and counselors? Because addiction usually is from an underlying issue, mostly mental. You'll find that someone is experiencing violence at home. You'll find that someone is facing financial constraints or just other underlying mental issues. So then how would you advise hospitals and health facilities to handle such cases? Okay, so it depends. And this has to be a looked at from a multi-sectoral approach. Because you cannot be working alone as a nurse, as a midwife, as an obs guy. You are not an island, you're not working alone. So of course we would make referrals. Like, number one, I would want this client to have some counseling. Because at the end of the day, if she doesn't know or she's not aware of the effects of what she's taking and even to her pregnancy, then she will not stop. So this is a client that I can even refer to the counseling department within the hospital. If she's on drugs, now we have rehabilitative programs. We can enroll her for one. There are hospitals that actually do that. And even for this condition we are talking about, well, the hospitals are very few that take care of this in Kenya, but still we can refer them. Actually, maybe we'll tackle that later. Yes.
So we work together. If there are other metabolic disorders coming up, because you'll realize alcohol also comes with other conditions. Talk about even diabetes, they are really closely related. And then, of course, there are other mood disorders that come about. I can refer this client to a psychiatrist and things like that. If there are any infections coming up, because you'll not even be able to take care of yourself when you can't think straight, we can refer them for medical attention. So we must work together. We must work together. And even organizations, the organizations that take care of those who have been, they are addicted or they really can't come off this, Kina Nakada, call them. We also have International Center for Reproductive Health. They can take care of some of these issues we are talking about.
Amazing. So now let's look now at the mother. For example, they are addicted. Interventions have not worked. You can't abort the child. So you've carried the pregnancy to term, and here you are giving birth. How do you tell that this child has fetal exposure syndrome?
Okay, so now
fetal alcohol exposure syndrome.
Okay, so let's say this woman came, she's pregnant already. She came to your clinic when she's already pregnant, and probably I managed to take the history. I have something, and you see the major history here, Birir, is prenatal exposure, intake of now the alcohol itself. That one is the major. By the way, this condition diagnosis is not like a blood test. You go take a blood sample and you test for it. No. So for this woman, because probably I may have an idea that she could have been taking alcohol, the first thing when the baby is born, because I am already expectant,
Yes.
I am going to have issues to do with low birth weight baby. Issue
So
when you look
low
at the
birth weight
yes,
is the
low birth
first
is the first. I'm
sign
just
and
already
symptom.
expectant. Yes, this baby may not be able to reach the optimum. We normally have a the weight for the newborns that is
Minimum
normal,
weight.
minimum
Yeah.
weight, and then of course there'll be issues to do with now the physical appearance of this baby. These babies look different. When
How
you
so?
yes, they look different, and especially the facial, features. So these babies have a small, we call it microcephaly. They have a small head. They have what is this called? The philtrum. The philtrum. You see this area here, there's normally
Between
a
the nose and the
depression.
mouth?
No, there's normally a depression. When you look at your mouth here, there's
Oh,
normally a depression
yeah,
here.
yes.
So for them, it is flat. Actually, that is one of the biggest telltale sign for these babies. They don't have this depression here. So this philtrum is indistinct. You can't see it.
Okay.
And then of course they have other things like a thin upper lip. So this upper lip is not well developed, it's very thin. When you look at the jaw here, it's also undersized. It looks also very small. There are other things like the orbital fissures. Now you see this spacing here, there is the standard, but then it's a bit narrowed like that. You see this nasal bridge here, it's also low, it's low set. So you see the way I look at you, you are well balanced. But for those babies, it is actually low set like this. So you actually literally see a very big space around this area because this nasal bridge has actually sunk down. And also when you look at their eyes from inside, okay, you look like there's a fold. The skin inside the eye has folded.
Okay.
That one is normally very distinct. Yeah, so we call them epicanthic folds. Yeah. So these babies are very, very unique. When you just look at them, they don't look normal like the other babies.
So
they
you
are-
can tell from
they are-
the
You
start
can
that-
actually tell. And that is why we normally say immediately babies are born, we need to do the initial newborn assessment. There is a reason why we do a newborn assessment immediately the baby is born. So that if there is need to refer this baby for further management, then we do it immediately. Yeah.
Now, when it comes to, now you've diagnosed
Yes.
the fetal alcohol syndrome. Is it treatable?
No.
What do you mean?
Fetal alcohol
So kama ni hivyo ni
syndrome is not treatable, and that is why I said there is no amount of alcohol that is safe in pregnancy.
child.
It is either you prevent number 1, prevent number 2, prevent
Stop.
number 3, prevent number 4, number 10. So it is not treatable. It will only manage, and like you see, we see the spectrum. There are many, but at the end of the day, we don't have a medication for fetal alcohol syndrome. We don't have a medication for fetal alcohol spectrum disorder.
So how is it managed?
We manage it symptomatically. Like now, whatever the baby is presenting with, if maybe let's pick, and let me pick fetal alcohol syndrome. For that one now, you see, remember when I started, I said we have cognitive and learning problems, we have behavioral and social problems, and we also have physical problems. So the focus would be, number 1, for this baby, you see, and by the way, diagnosing this problem is quite hard.
It's hard.
It's very hard because it also mimics others, like attention deficit hyperactivity
ADHD.
disorder, ADHD. It also mimics even depression.
Down syndrome.
Yes, it
Because I
mimics
would
quite a
imagine
lot.
the cephalus, you said
Microcephaly.
Yes,
microcephaly. Did you say
Microceph-
microcephaly?
yes.
Microcephaly. Yeah. So you see, it mimics many other conditions. So it will be very hard. And like I said, Birir, there's no blood test we will take to say, now this baby has fetal alcohol syndrome. So at the end of the day, it becomes hard. The only thing that can help us to now help these babies, we have done the first physical assessment. We have noticed this problem with weight and height. We have noticed the physical appearance. Now we are saying, okay, we are getting somewhere. Number 3, this baby will be growing. And you'll realize there are changes. So this woman has to be told what to expect from the baby as they
the
are
baby
growing,
grows.
because there'll be problems that we are anticipating, things to do even with speech. They'll have slowed speech or delayed speech development. These are people who will be very slow in learning. You are wondering, why is my child not good in mathematics? And mathematics is actually a problem for them. Yeah. So these babies, they are slowed down quite a number of aspect of their growth. Now, number 1, we need to take care of their cognitive and learning. So now that's why we need to enroll them to we call it early childhood intervention programs. Now, these are special children. They cannot just mingle with others because we need to work a lot on how they are growing. Interaction, coping mechanisms, emotional development. They cannot make decisions. Judgment is poor.
So all those are affected when they are exposed to alcohol?
Yes, that one is serious. And you see, most of this is hard to reverse. They'll have to just develop with them. But now we put them on therapy. We just make them now. It's like you're training them to be able to do and to actually go through the milestones like any other child. It's actually very, very difficult to manage this. If the parent doesn't understand, they will not be cooperative. We need the man here. And actually, I was going to talk about male involvement.
When you talk about men,
we need the
I want
men
you to hold it.
here.
Because that's a whole other
men,
discussion that we will have after the break. But go on with now the managing of the conditions.
Yes. So now I've talked about the cognitive. Here is where now we have to help this child be able to concentrate. How can we make this child be able to have attention? How can we be able to make this child maintain good memory? Because they'll have a problem with that. IQ levels, they go down. They can't make decisions. They can't make judgment. And at the end of the day, you realize that it becomes very difficult if the support system is also very low. Look at now the behaviors. These are children who are hyperactive. They are impulsive. You know, you say something and they are, they just react without even thinking. And it's not because they are not thinking. It's because they have a problem. They are sick. They are not well. These are children who can't maintain relationships. They don't know how. They don't have that social, intelligence. They can't interact with people. They can't talk to people like other. They just end up becoming very impulsive and emotional. Yeah, their emotional development is also very poor. So you realize that we'll focus on developing their cognitive. We also focus on behavioral. For the physical, we only manage what we are able to because those ones we can do nothing about. And probably we need to see photos of adults who have this condition because they are there. Yeah. And then, of course, now I've talked about the speech. We need to have speech therapy for them. So we need to enroll them to a program for that to happen. And then, of course, now we involve the community. You see, community... community is big.
It's big.
Do you know this condition also comes with a lot of stigma?
Yes.
So they can actually decide to hide the children. Yeah, and no one will talk about it. Can we actually empower them to speak out if some of these things? So we need a lot of sensitization. We need to go into the community and help them to understand the dangers of alcohol, and especially areas where alcohol is like food for them.
Yes.
Yeah,
and
it's food. The mamas are there, everyone is there. Babies are also there. They are all drinking.
Yeah.
It's a serious thing. So community is a big one. Let's not even talk about individual only. Let's look at the community. Because they'll be part and they'll be part and parcel of how can we let's just keep quiet about this. So the baby will grow without any support. Now talk about nutrition. Yeah, for the women, of course, when they are pregnant, we can give them some supplements and we can make sure they eat well. There's a supplement that is called the choline supplements, and these choline supplements help in the neurological development and brain development of the baby. So if we identify early, we can actually help this baby even before it is born.
So it is important to identify early. Yes. You've called it the newborn, how do you call it? The assessment of a newborn.
The assessment of a newborn it will be done once the baby is born.
So but once you identify, then it is better to manage.
It is better to manage
the conditions.
Exactly.
I'd like you to hold for a bit and we'll take a short break. When we come back, of course, we'll talk about how to manage the condition further and also how to prevent it, because the Daktari has said it is better to prevent than to start managing the condition. And we'll also talk about how to involve the community and also men. How can men be involved in preventing this fetal alcohol syndrome? Don't go away.